I will talk about Liaison Psychiatry and Pediatric Consultation. So this is the flow of my presentation. First, I will start with introduction, then the history, consultation steps, and conclusion. Consultation refers to consultation, discussion, and meeting process with a medical doctor in order to receive advice, and liaison means cooperative relationship and building such a relationship. Pediatric consultation, liaison or pediatric consultation care, psychological and psychiatrical care is provided to children by psychiatrists, children psychiatrists or psychologists. Both child and adolescent psychiatry has an important subtype, which is liaison consultation, and some major morbidities and mortalities prevalent among adolescents and young people are tackled in this field. The aim is to help general medical doctors. In recent years, the changes in the current healthcare sector, psychosocial factors have been identified, and now pediatrical healthcare consultation services are demanded even more, especially during the last 2 decades. Treatment of childhood diseases with high mortality rate has been evolved, and such progress made in this field is very positive, especially right now for leukemia. The survival rate is 95%, and nearly 8% of the children are thought to have a chronic disease affecting their daily functionings. And according to current data, children with such illnesses are under great risk. In comparison with their healthy peers, children with medical diseases are under risk of developing mental diseases, somatical complaints, anxiety, depression, or social withdrawal are among the problems that children with chronic diseases suffer from. So what are the duties of consultants? Mental health consultants treat children with primary and secondary chronic diseases. They help them to adapt to daily life, and they try to help them to cope with anxiety, and they also support their parents. They provide support to medical service personnel. They liaise with medical service staff. So looking at the history, adolescent consultation liaison psychiatry is not sufficient for making a distinction between body and mind, and it first emerged in 1930. After recognizing the importance of psychological factors in the adolescent medical health care, the needs of children were also focused. In 1980s, the first KLP units established in Turkey. Regarding the consultation steps, as you can see, there are 7 steps, consultation steps. At first, the process starts with consultation demand, and then the consultation team is seen, and then the medical data is reviewed, a psychiatric review, formulation, mental state identification. So starting with consultation demand, in inpatient pediatrical clinics, psychiatric consultations focus on some adjustment problems, disharmonization, depression, suicide attempt, pain management, psychosomatical problems. In this section, consultation can be demanded by the parents when the consultation team is seen. There are certain steps to follow. At first, we should understand what is the problem of consultation and what's the emergence of the consultation and who will be dealing with the family, who will be seeing the family. Discussing a certain case with the consultation team as part of consultation liaison for a pediatric patient helps us to follow the same path and to collaborate. If it's possible, prognosis of the patient should also be consulted and a second opinion should be received. Parents should also be informed by the consultation liaison team. The involvement of the parents is quite restricted in the first steps. The reasons for consultation should be ensured to be written down in the consultation report. The following step is a review of the medical data before talking with the family and the child. The medical history of the child should be taken. Laboratory results and the medications that are used by the child should all be listed, and after reviewing the general medical condition of the child, we proceed to the consultation process. At first, we start with the family and the child. It's a conundrum actually. It's not clear whether we should see the child or the family first based on the age of the child. We should decide whether to see the child or the parent first. Of course, if the parents of the child accompany the child, the process will become more smooth. But of course, it depends on specific situations. There's not one clear-cut answer to that. If the family is next to the patient, at first the family is informed about the consultation and they can be asked as to how to proceed. Especially if there are worries about the sensitive matters such as abuse, we should allocate sufficient time both to the child and to the family. Within the framework of social formulation, we should see both the child and the parents separately or together, depending on the situation. Of course, a developmental stage of the patient should be considered by checking the mental state of the patient. It will be very useful to ask these questions during this process. How much does the child know of the treatment and the prognosis, and what's the effect of the illness on the child's siblings or peers, and what's the impact on the child's school performance and the relationship with the medical team? How is the relationship? Such questions should be answered. As we see the family, we should try to take history of the child, such as the date information, birth information, developmental information, social development, and education history should be taken. And the parents' opinion about the psychiatrical diagnosis and treatment. This is really crucial because it allows us to identify support mechanisms. It is highly critical to evaluate opinions of the family because in this process, if we learn any significant diseases, this information will be quite crucial for our treatment process. It's very important to learn how the functionality of the family is related with the illness of the child. According to some studies, the anxiety levels and stress levels of the family affect the psychological harmonization and adjustment capacity of the child. Among the stressors of the families, we can say increased costs and significant changes in the daily routines, decline in employment, etc. Parents of chronically ill children have lower level of life quality, and there are some evidence showing that psychiatrical symptoms may also be observed. The children who got better after becoming cancer have shown stress symptoms later on in their lives. And after recovering from a chronic disease, there can be some other symptoms such as adjustment problems. We should consider this. Siblings of a chronically ill child are also very important as we focus on the parents. At this point, healthy siblings can be disregarded, and we should also consider them. Regarding subsidiary resources, nurses and pediatricians can be consulted following the first evaluation by taking permission of the family. Subsidiary resources can be consulted as well, which may include teachers, psychotherapists, and social services. Which brings us to the formulation part. At first, I will start with the biopsychosocial model. The child-related factors, context of the family, and the treatment team, these all constitute a very complicated system which may affect the psychological harmonization, adjustment of the child. Siblings, peers, family members, and the community members are all affected by illnesses of a child. Therefore, biopsychosocial model provides us with the most comprehensive model available. So it also provides a holistical approach to understand the psychological situation of children and adolescents. Here in this diagram, you can see main theoretical principles showing us different systems and their impact on the psychological functionality and adjustment. You can see in this graphic there's the chronic disease mesosystem, exosystem, and macrosystem. They are double-sided and affect each other. Factors affecting functionality of a child also involves ecological systems. The circle at the center represents individual factors affecting the functionality and psychological adjustment of a child. For example, the developmental stage, cognitive functionality, and characteristics and coping mechanism capacity of the child. For instance, if the child has a chronic illness, the child's functionality will be impacted. When I say microsystem, I mean the closest social system to the child, which may contribute to the social adaptation of the child. The macrosystem impacts are accepted as the most determinant factors affecting the functionality of the child. Inside the microsystems, we can see cultural beliefs, social values, judicial systems, and medical technologies affecting the system. Inside the exosystem, we can see different contexts inside the mesosystem affecting social relations and functionality, social values, and pediatry-related effects are all part of the microsystem. As we do our formulations for treatment, it's very important to take a look at this diagram. Medical and psychiatric functionality, previous medical and psychiatric functionality of the patients is also very important. Sometimes families can develop other coping strategies to deal with the impact of the chronic illness as you focus on psychiatrical dimension of the illness. In the developmental approach, children and adolescents continue to develop physically and cognitively. Therefore, it's very important to constantly evaluate the developmental level of the child, especially while discussing death and coping with the treatment. It's very important for us to understand the developmental level of the child. Additionally, potential disorders of medical chronic illnesses should also be taken into account. When we talk about patient-focused approach, we should definitely understand that there will be some specific problems related to a specific medical condition. We should be aware of that so that the child feels comfortable sharing different features of different diseases. We should inform the child. During mental state diagnosis process, trauma and the effect of the medications, there are certain factors impacting the mental state of the child. Therefore, there should be an identification process by looking at the look of the child, motor functions, speech, emotional state, feelings and thought processes, memory. There can be certain retardation concerning maturity if we get suspicious about any symptoms related to such factors. We should support our knowledge by receiving additional information from the school and other units. So finally, providing consultation to the team members. The hospital notes are created after the first consultation by incorporating the consultation observations with the team members. In the formulation and suggestions section, we should avoid using psychiatrical terms. Improving coping and tackling behavioral problems, ensuring security can be possible by providing clear and practical suggestions. Consultation should provide concrete and practical suggestions, and consultation note of the patient should be created by taking into account that it will be read by the parents of the child later on. And finally, the emotional and behavioral problems of the children, inpatient children with chronic illnesses. Their coping mechanisms can be supported and their adjustment can be improved with the help of Pediatric Consultation, Liaison Psychiatry.